No, that's still valid.
That's cool. It's like, once he comes in, oh, that's right. Once he comes through the door.
Immediately.
You can open up the mic.
So any heads up you can get.
I think that's the problem. His receiver, whatever frequency he's tuned to, I've never had a problem. Morning, young lady. That's what we were saying.
Oh, well, yourself.
Is this where we're gonna sit the whole time?
I had no idea.
Well, I'm just gonna be next to you, don't think I'll be in here or anything.
Not at all. Hey, you look comfortable. Doing this time.
Oh, lovely.
Good.
We'll figure it out when we figure it out.
Yeah, you see that shot? With the podium? Alright. Yeah.
Good morning. I want to make it clear that a mask mandate remains in place in St. Louis County. There is currently a lawsuit challenging that mandate. Until that's resolved, masks are required in all indoor public spaces. Now, let me go over some of the reasons why we put the mask mandate in to begin with. As of June 1st, the number of cases per day in St. Louis County was 40. As of yesterday, that number was 243. On June 1st, the positivity rate was 2.9%, and now it's 10.5%. Over 50% of those in St. Louis County have initiated the vaccine process. Back in May, when we lifted most public health protocols, we thought that more people would be vaccinated by now. The virus is simply spreading faster than we are getting people vaccinated. Masks slow down the spread while we continue our aggressive efforts to make the vaccine available for everyone. 24 hours after we announced the mask requirement in St. Louis County and St. Louis City, the CDC recommended that everyone in K through 12 schools wear a mask, regardless of their vaccination status. That includes staff, students, and teachers. The CDC is also urging people in areas with high COVID-19 transmission, like here in St. Louis County, to wear masks. The head of the CDC, in making her remarks yesterday afternoon, encouraged leaders at every level of government to recommend vaccines and masking. The Delta variant is highly transmissible, and it's jeopardizing our progress. These numbers are too alarming to ignore. As healthcare professionals and as elected leaders, we can't stand idly by and let this Delta variant rack up more and more victims with each passing day. While we are diligently working to get vaccination rates higher, masks will allow our kids to get back into the classroom. Masks will allow our businesses to remain open, and masks will allow our economy to continue growing and to keep people employed. And masks will allow us to keep doing what we're doing while more people get vaccinated. Masks will help slow the spread of the virus while we continue to do all we can to get more people vaccinated. Masks and vaccines working in tandem are the path to a safer St. Louis County. Local legislators, many who hold full-time jobs outside of government, are under enormous pressure with the passage of a recent state law on public health orders. While mask mandates are not one of those public health decisions for our legislative branch, it's the right thing to do to keep our legislative branch informed. Our health director is always available, like he was for council members last night, and members of our health department take calls frequently from members of the council. We are partners in governing and following the guidelines of public health experts is critical to a strong partnership in tamping down misinformation. This is a difficult time in the history of our region and our country. Emotions are running high around public health protocols. We must listen respectfully to those we disagree with, and that includes other elected officials and members of the community. While the vaccine can protect against symptoms of the virus or mitigate symptoms, it does not prevent everyone from becoming infected and passing COVID-19 along to others who are more vulnerable. And that's why we are requiring everyone to wear a mask regardless of vaccination status. Until more people get vaccinated, we all must continue doing what we can to protect ourselves and others. As the head of the CDC said yesterday afternoon, vaccines combined with masks is a proper prevention strategy. The new Delta variant, which has unique behaviors from other variants and is highly contagious, represents 80% of the new cases in the United States. Wearing a mask is easy to do, and it'll have a big impact. Please get vaccinated as well. The vaccine is widely available. Today, from 2 to 6 p.m., the Lewis and Clark branch of the St. Louis County Library will provide a walk-in clinic. For a complete list of vaccine opportunities, please go to revivestl.com. That's our new website surrounding vaccine information, revivestl.com. Thank you, and I'm happy to answer any questions.
Dr. Page, the citizens of St. Louis County are clearly getting two polar opposite messages about the mask mandate at this point. You're just saying it is still in effect. Councilmember Fitch, who led the opposition to repeal or overturn it, calls that PR magic this morning on social media. What is your message to the citizens of St. Louis County about how they should be viewing the mask mandate at this point?
Well, there's a lot of political rhetoric around the conversation of public health orders in our community and in our country. But the proper place to adjudicate a public health order is in court. And for the past 18 months, St. Louis County Department of Public Health, along with other health leaders in our region, have made some very difficult decisions, and people in our community have followed them. And the reason why we are in a better place in St. Louis County than other places in the state and other places in the country is because our community followed the direction of our Department of Public Health. Many of those public health orders ended up in court, like we are now, and on each occasion, 8 times, our public health department prevailed in court, and our public health order stood. This current public health order is in court. The Attorney General has sued St. Louis County, has sued St. Louis City, and since Kansas City issued a mask mandate yesterday, I expect that that Kansas City will be sued as well. And that's where these are adjudicated. But elected officials certainly can enter into political rhetoric and name-calling and all of those things. I don't think that is productive, but the court will determine where this is. And until then, the law stands. If there are any further restrictions surrounding business closures, then that's what triggers the state law. And it's very clear in the statute, and I expect that a court will get to that question soon enough.
So then, should the citizens continue to act like there is a mask mandate in effect? Or what would be your message?
Well, first of all, the citizens should wear masks. That's what the CDC says. That's what the American Academy of Pediatrics has recommended, especially for children who under 12 can't even get vaccinated. And so if you have children in your house, if you're around children, they can't be vaccinated, and this new Delta variant is affecting younger and younger people. So we should wear masks because it's the right thing to do. We should wear masks because the CDC asks us to, the Pandemic Task Force asks us to, and our public health officials ask us to. Yes, it's a mandate, and we'll deal with it like we dealt with the last time we had a mask mandate. We'll look at this on a case-by-case basis. We'll make sure the word gets out. We'll continue education efforts, and I expect we'll see the same thing as we saw before, that folks will come into compliance because the vast majority of people in our community just want to do what's safe and do what they can to protect themselves and their loved ones and the people that come into their places of business.
Can you lay out a timeline for people of what will happen next
the question is what will happen next. We're going to go on with the business of St. Louis County with our outreach efforts to get people vaccinated, to continue our efforts to let people know that they need to put on a mask and follow the guidelines. We'll work in partnership with our school districts who are communicating the importance of mask wearing in K through 12 in order to get kids back in the classroom. Masks are really going to be a big part of the protocols that allow kids to go back into in-person learning. And that's very important for our kids. So keeping the virus at bay in our community, getting masks on kids and teachers and visitors to school is very important in that in-person learning piece. So we're going to continue to educate folks on the importance of following public health protocols. We're watching cases skyrocket across the country because of this Delta variant. We'll be watching the data very closely, continue our discussions with the Pandemic Task Force and the health system leadership in our public health department. And we'll press on. We have an extraordinary community outreach program for vaccinations. That's why St. Louis County has one of the highest vaccination rates in the state. Over 50% of our community have had one shot. Unfortunately, that's not enough. And that's not, and this is an example of every effort we can make in St. Louis County to put this virus in the slow lane and slow it down, and we can do that with masks. So we can continue our vaccination efforts and get ahead of it.
Dr. Page, what do you call, or how do you respond to the tweet by Tim Fitch calling what you just explained there PR magic? That this is still in effect?
Well, I think that was your first question, is what do I say or do about political rhetoric and organized efforts in the community by some elected officials to discourage vaccines or discourage masks or discourage any public health protocols that save lives and protect people in our community. And this isn't just a St. Louis County problem. This is a national problem that went all the way up to the top with the last president. And we do have some folks in our country that work very hard to undermine public health efforts, and with a lot of very inflammatory rhetoric. I'm not going to engage in that. I'm going to focus on relaying the decisions that are made in our public health department, trying to answer questions about those decisions, trying to keep St. Louis County on track and to keep us where we are as one of the best positioned regions in the country in fighting this pandemic. We're better off than a lot of folks in the country because we made some tough decisions and we made some sacrifices. Putting on a mask is a very small sacrifice to make for the kids to get them back in school, for our small businesses to keep them open, and for your neighbors to keep them employed in their jobs.
This legal process that lies ahead here, maybe in Kansas City, you said, will that be costing taxpayers?
Well, I would expect that there'll be some private effort in that. Certainly the lawsuits by the Attorney General cost the taxpayers money. The county to defend litigation costs money. A lot of the things that the county does have a cost associated with them. We have to make decisions about that, but protecting the health and welfare of people in our community is one of our #1 responsibilities, and if there's a cost associated with it, then we're going to do it, just like we've done before.
Kenzie, do you believe that anything that you did to, or that Mayor Jones did to put the mandate in place violated that state statute in terms of consulting with the county council or
No,
those kind of things?
Absolutely not. The state statute says that we should notify the council concurrently with our decisions. The executive branch of government makes executive decisions. The executive branch is here every day, and we make immediate decisions. The council meets once a week, and they review decisions, and they pass budgets and ordinances, and that's the relationship of government. And within 24 or 48 hours of making this decision, we notified the public and we notified the council. Notifying the council is notifying the public. Notifying the public is notifying the council. When the mask mandate took effect on Monday, we immediately, concurrently, at the same time, notified the council of the rationale behind that. We asked for an opportunity to present. Most of the time yesterday was spent grilling the health director about the process and not about the policy behind the process. And there was a rush to vote down the mask or vote against the mask mandate. And most of the discussion was about process. In fact, if you listen closely to what the council members said, they said, a lot of them said very proudly, we voted for a mask mandate in the past and we want to do it again. We just want to do it ourselves. Now, the challenge with that is that the council meets once a week and it takes them a long time to pass an ordinance. And we don't have a lot of time to slow down this virus. And we are where we are as a region as compared to the rest of the state. Our hospitals are not full with kids because we made some tough decisions, and time is of the essence. I hope the council is true to their conversations that there is support for a mask mandate, and they'll pass some sort of resolution supporting a mask mandate. But as far as the law goes, we're following the law like we have every time. There's been a lot of conversations in the past about what the law is, and the court sorted it out, and the county health department was supported on every occasion. I understand that there is a lot of attraction and a lot of magnetism to conflict. But I think, and you'll have to report that, I guess, but I hope some time is spent reporting on what the right thing to do is. And the right thing to do is to follow the CDC guidance, follow the guidance of the American Academy of Pediatrics so we can get our kids back in school and in-person learning, follow the guidance of our public health department and our pandemic task force and our health system leadership, and let's keep our position. I mean, this is a race, and we are at the front of the pack right now in this race because of the decisions we made over the past 18 months, because St. Louis County and our community made the sacrifices to get us where we are today. We made those sacrifices, and we're in a much better shape. We are not yet overrunning our hospitals, and we're taking overflow from other parts of the state. But this virus, these cases, and this curve is shooting straight up. And if we don't make some decisions fast, we're going to be in a bad spot. And all these conflicts and conversations and misinformation about vaccines are going to put us in the wrong place. So if we can follow the recommendations of our public health department and the CDC and all the other experts, then we will continue to be in a better spot. But we are headed for some tough times.
Dr. Page, there are claims that the health director flipped off the crowd last night. Have you heard this? Is there an investigation? Would you like to respond to those claims?
Yeah, we'll look into that. I mean, I wouldn't want to see any sort of unprofessional behavior by anybody on my staff. Emotions were high last night. I mean, if you saw the room, there's a lot of emotion in the room, but I would expect my staff to stay above that, but we'll certainly look into that. I heard that late last night.
Based on the 8 previous lawsuits that you mentioned, is there a time frame that you would see this lawsuit resolved because of the confusion in the community, the need to expedite this?
Yeah, I mean, the confusion's unfortunate, but that's where we've been since the beginning of the pandemic, 18 months. There's always been some initial confusion around public health orders, and then they get sorted out. That's not unique to St. Louis County. That happens every place in the country, in every state, in every local region. And we'll try and move the court along as fast as possible, but they are on their own time schedule.
Anybody else? Thank you.
All right, thanks.